If we are to understand the issue of the upcoming big data decision making in all areas of our life, in law and also in medicine, but we'll concentrate on medicine, versus statistical based decision making, it is actually, even though it's a brand new subject, it's actually discussed in Jewish law, I think, at great length and great elaboration. And the reason is really very simple. If you ask yourself, if you go to classic literature, would you find something about big data and statistics? And the answer is no, because it's something new. But I think that in medicine, the answer will be yes, because what is the idea of big data, artificial intelligence or deep learning? It's all a name to trying to reach conclusions without preset models. The decisions are derived from the data. Computer networks interact with each other to digest raw data, and actually it's simple learning from experience. I'll give a simple example, and this example will serve us with our discussion of medical decisions. I'll talk about legal decisions, because I know whenever I talk about it with people that are in the subject, they get angry. So with people that deal with medicine, we should speak about legal issues, about law. In United States, every person is assumed innocent until proven guilty. So there is no way to apprehend a person, to arrest him, to keep him in jail because he was caught and he's accused of either shoplifting or murder. He's innocent, he's presumed innocent. And until he stands trial and is proven guilty, then there is no way to take away his liberty. The only thing that the legal system can do is to guarantee his standing for trial. So actually, every suspected criminal has the right to go on bail, to be released, and the bail has to reflect the need. The bail has to be a money, a sum of money that will guarantee his standing for trial. Now, of course, the question is, how much money do you? How great is the bail? What sum of money shall we impose on the applicant that wants to have the bail? And the answer is there is a model that courts use, and the model depends on whether the suspected criminal has family in the area, whether he's a job in the area, how old is he, how connected is he to the area, and of course about the crime. Is the crime severe enough to make him want to run away, to disappear? And they take all this into consideration, and the judge sets the bail. Now, in some Western states, in the United States, the rate of people standing for trial, not jumping the bail as it is called, it was about a little bit less than 60%, meaning 58, 59% of people in Colorado, in Nevada, and I think also in California stood for trial. The rest disappeared. And they decided to give the information, to give the decision to big data, to computers, in which they took files from 30 years, since they started putting them on computers, and simply feed the raw data into the computer. The way that it works is like this. First of all, they feed an X amount of files into the computer and tell it the result. The guy jumped bail or came to trial. And then they keep putting files, and they ask the computer, what do you think? What do you predict? Did the guy jump the bail or come to trial? And if he's right, you let it go. And if he's wrong, you do it again. And then the computer learns without forming any rules with what data, what what data will predict that the person will come to trial. And there are no models. There are no models that you can formulate. There is no correlation, just the raw data. On one side, there is the raw data. The other side, you have the decision. So the recent success of the system, this was in 2016, end of 2016, it was about 97% of the people did not jump the bail, came to trial, and the median bail did not go up, meaning the bails more or less stayed the same, but the division was different. The same thing can be in any area of drawing conclusions when you have a lot of data and you have many possible correlations. So you ignore the correlations and you simply feed the raw data to computer. You use past experience. Again, you train the computer and then you let the computer decide, or you let the machine decide. And when you want to ask yourself or the machine, what was the reason? Why did you recommend surgery here and chemotherapy here? Why did you recommend no treatment here and treatment here? It won't be able to answer. Of course, you have to dictate the outcome. You have to tell the computer what outcome do you want. For example, the outcome of a person of the right to die or ethical issues have to be input. They cannot be, the computer cannot figure it out for itself. But you can say in some cases, there are ethical considerations that will let a person not get a treatment because he doesn't want to be treated. We are talking about a clear outcome. Will he get better or will he not get better? That's the only thing that is done. Of course, you can add other outcomes as well. Now, can you trust such a system? Is such a system valid legally, ethically? Meaning you don't know the reasons. The computer comes up with the answer. You don't know the reasons, but you see that it's usually successful. Is it a good system, a valid system? And should it replace human decision-making based on statistics? And especially now in the era of evidence-based medicine, which is exactly the opposite. In evidence-based medicine, you build models and you try to figure out the exact correlations between circumstances between input and output. In the big data, where you don't have these correlations at all, you have no idea about the correlations. In Halacha, there are several issues. In the Jewish law, there are several issues that consider one is the medical procedure itself. Is it good medicine or bad medicine? Interestingly, in Jewish law, we don't have this discussion because the medical profession is a closed guild, like carpenters, like shoemakers, and they have their own way. You can choose either use them or not use them. They're either good or bad. But once you're in their hands, this is the guild, and whatever they do is they do according to their own rules. So I never came across an idea of this is bad medicine versus good medicine. However, in several cases, a person that is in danger of life has special privileges. For example, we are now close to Yom Kippur for almost 2 weeks, a little bit less than 2 weeks, it will be Yom Kippur. And, in 2 weeks will be Yom Kippur. And Yom Kippur, people have to fast. And for some people, fast is very traumatic. Fasting for 24 hours, they find it very unpleasant. So people that are ill and are in life-threatening situation are exempt from fasting. The question is, are they in a life-threatening situation that could be made worse with fasting? Who decides? So then the physician's decision have to be, now we have to consider the validity, because this is not within the carpenter guild, not within the doctor guild. This is something that pertains to other areas of law, and we have to start talking about the validity of the medical observation. There is a verse that is quoted, verse on Proverbs 14, which is central. It's quoted in every aspect of this discussion. And King Solomon says something about something very personal. And the interpretation or translation of this verse matters a lot. There are two ways there are many, many ways in which this verse is translated and understood, but in our discussion, it's really the heart of the matter. It's the heart. It talks about the heart. The heart probably means the self, the person himself. And it's, in Hebrew, it is Levi yodea marat nafsho uvesimchato al it'arev zar. And the translation, the classical translation, is the heart knoweth his own bitterness, and a stranger doth not intermeddle with his joy. So if we just read the verse superficially, it's actually autonomy. The heart knoweth his own bitterness, so a person can decide he's in a dire situation, what to do about it. Does he want to get out of this situation? Does he want to stay in the situation? Some people enjoy. We have, as Dr. Gold speaking after me, maybe he'll say that some people enjoy suffering. So if you release him from your suffering, you take away something very precious from him. He doesn't want to be released. He doesn't want to be healthy. He's happy to be sick and wants to stay sick for as long as possible. So the heart knows his own bitterness. He understands, he reckons his own bitterness. And the same thing with happiness. The joy is the same way. We don't have objective joy. We don't have objective bitterness. Or some bitterness is joy and some joy is bitterness. So the patient has an autonomy. If you use it in medical ethics, a patient has total autonomy, and he says treat or not treat, do not treat, do treat. He is, but this is not the way that the sages understood this verse. And they said, no, everyone wants to get well. Everyone has an obligation to get well because everyone is a duty. People are not free agents. People are obliged to, they have a duty in the world. So they have to see to it that they are well and their mental health is they enjoy mental health and physical health. So the idea that the heart knoweth his own bitterness, it talks about the treatment. What is the desirable treatment for a certain bitterness? So a person knows best how to treat his problems. And this is another kind of autonomy, but this is not the autonomy treat or not treat, but what is the desired treatment. So according to Jewish law, a person has the first say about his treatment, and the law is that even if doctors say he doesn't have to eat on Yom Kippur because nothing will happen to him if he doesn't eat, on the contrary, it will improve his health if he does not eat, and still he says, I'm suffering, I want to eat, and this will endanger my situation, you listen to him. Now, what is the idea? The idea is that basically, how can a physician make a prediction? This is the issue. Anyone that read Daniel Kahneman's Thinking Fast and Slow, the book which is an excellent book about decision making, actually it's about behavioral economics, but it's about decision making, tells the story of the firefighters in Ontario. They came to a small house, and because they were told there was a fire in the house, and the commander of the firefighters entered the house with his platoon, and they right away, he says, everyone leaves within 2 seconds. They all left, they all cleared the house, and the house collapsed. They interviewed him to find out how did he know that the house will collapse. They said, I just felt it. It was a gut feeling. I cannot explain. But he told him it's impossible. They debriefed him for 2 weeks. After 2 weeks, he understood the reason. He said, when I entered the house was too hot for the fire that was evident. So there was not enough fire in the house to create the heat that I felt. So I had deduced that the fire was in the basement. Since the fire was in the basement, so the floor of the house was on fire and the house was going to collapse. And that's what happened. But it took him 2 weeks to realize the correlation. So what happened? He had from experience, he has data. Somehow he digested the data, played with the data the same way that a computer does, that a neural network computer, the deep learning does, and he reached a conclusion. So experienced physician maybe cannot give you a reason, or maybe the reasons are stupid, maybe the reasons are irrelevant, but he has intuition. Another way is, he says, I understand what you have, I know what the usual treatment is, I know the treatment that works, I have a statistical model, and I'm going to use this model to decide about your treatment. What is the difference between the two attitudes? What is more reliable? Both. Both are quite tricky, but there is a basic difference between the two attitudes. Statistical attitude, which builds a model of correlations, cannot predict what will happen. It doesn't even try to predict, does not pretend to predict the result for a particular patient. They have no idea what this patient will do. They have another saying. If many patients were in this situation, let's say 40% will recover and 60% will succumb. But that's it. It doesn't speak about you. It speaks about something in the people like you. Many, many people like you will get this. This is the probability of the success or of the failure. Intuition is about you. The big data is about you. For example, if you take again the Bail files, the Bail doesn't say everyone that doesn't have a family or 60% of the people that don't have a family in the area and earn less than $2,000 a month will come to trial if you put bail of $10,000 on them. This is not the issue. Now, I don't know about everyone. He will come back, and actually people don't know why. No one knows why the computer made this, how this decision relates to the data. So intuitive decision, actually we learned something very important, that intuitive decision relates to the patient. This will happen to you. Evidence-based medicine, statistically based medicine relates to people in your situation, what will happen to them. What is the more valid now in the concept? What is a more valid concept? So here King Solomon says, the heart knoweth his own bitterness, and a stranger does not intermeddle with his joy. Meaning, what is the valid decision about me? Not about people like me, but about me. So that's why when the patient feels something, that his life is in danger, we say that because of evolution, because of things that happened to him with his pregnancy, because of things that happen in life, something in his brain knows or feels or can reach a conclusion about his situation, about whether his need for food or his need for a certain simple treatment. I'll just have another sentence after that. But this thing is, we trust his intuition because he is in the best place to have this intuition. It's because he has the most data about himself. He collected in his brain his own data throughout his life, even though he's not aware of that. So his decision is not legally binding, it's the most valid decision. The same thing that is why this decision, the big data or the intuitive decision is considered to be more valid than statistical. Now, what about medicine? What if he says, I need antibiotics? What happens if he says I need certain medicine? And the physician tells him you don't? So this is very interesting. This was discussed only in the early 16th century by Rabbi David ben Zimra, who lived in Egypt. He moved between Egypt and Tzfat in Israel. And he said, this is a totally different story. If a patient does not have an experience in medicine, he just says, I need this medicine in order to be better, something that then at that time was called medicine or medical treatment, not simple food, water, or temperature, but something that is specifically comes with specifically medical expertise. Of course, his intuition is totally invalid. Not it is that doesn't have the autonomy. He has the autonomy, he has the right, he can consider various opinions, but his own intuition is simply not valid. So, to sum up, I think that in Jewish law that is based on this verse, a valid decision is decision about a particular patient, about the case in hand, and not about patients in general. That's why intuitive decision is more valid than evidence-based statistical model, and definitely when it's strengthened with the tools of big data. Thank you very much.